Welcome, empowered ladies. Enid and I would like to welcome you to another episode of Mari Trilogy. And today we're going to have a hot topic, and that is surgery after weight loss. We are back at Dr. Soler-Baillo's office.
Very excited.
Thank you so much, doctor, for your time today. We really appreciate you. You know the drill. We have our questions, and you are welcome to elaborate on anything extra you want to focus on. But
I think, well, first I want to thank you guys. It's always lovely to be with you ladies and help everyone get a little bit more education about what's going on out there in the world of plastic surgery, beauty, and wellness. So let's go.
okay, so let's dig deep into this hot topic. Your first question is, can you explain what traditional liposuction is and how it works?
So liposuction was developed actually pretty far back. And it was actually someone's idea to take out fat from the body by using what's called a cannula or a tube with a hole in it and attaching it to a vacuum device. So the first liposuctions were very rough. They use really large cannulas. And technically what it does, a cannula goes in under your skin, sucks the fat into the cannula, and the action of moving the cannula, tears the fat away. And fat's pretty easy to rip out of the body. Our skin is tough. Our fat's very, very flimsy. So the original liposuction was just doing that. The problem was half of what you would take out was blood. So the most you did liposuction out of someone was 2 liters. Because if half is blood, you're taking out 1 liter of blood. And we only have about 5 liters of blood in our bodies. So it used to be a pretty intense operation. We then modified it, especially famously by a dermatologist in California named Klein, who developed the tumescent liposuction. And that allowed us to put lots of fluid in there with local anesthetic, lidocaine, and epinephrine. And it made the liquid that came back out with the fat a lot safer.
How?
So that is traditional liposuction. It's literally physically sucking the fat out from the body.
So, Dr. Soler, how long ago did this procedure start?
So they've been trying to do this for a long time, as you can imagine. So all the way back to the 1920s, people have attempted to do this, but more formally in the early 70s, around 1974. And this, again, large cannulas, huge defects because people didn't really know what they were doing. So they're taking out too much fat in certain areas, getting tremendous contour deformities. So it's not a very well refined operation.
Those poor people who started, they were the guinea pigs.
But that is a very good warning to women. Those early people that try it, well, everyone today should remember, not to be kind of the first ones jumping at, but sounds really good. So remember that.
Yeah. How does a liposuction differ from other fat reduction techniques like CoolSculpting, laser liposuction, Morpheus, and Sculpt?
One of the things to best understand liposuction is to understand what a fat cell is. So a fat cell is a storage unit for fat. And we have a very defined number of fat cells in our body. When we get heavier, they just get bigger. When we lose weight, they get smaller. But we have the same number in general. So what liposuction or any fat destroying technique does, it removes some of the numbers from your body. So imagine they're like banks. And there are certain neighborhoods that have lots of banks. And what liposuction is doing is you're reducing the number of banks in certain neighborhoods. So when you do gain weight, if you do gain weight, you gain weight in other areas. You don't have so many branches to deposit. So this is where the myth that the fat goes somewhere else.
I was just going to say that, yeah. I've heard that.
Is that the fat is going to go somewhere else. No, the answer is if you get heavy, the body will find another branch to deposit the fat. And it will look like fat went to somewhere else. So the truth with properly done liposuction is if you keep your weight, you tend to keep your result. If you gain weight, you're going to start looking weird.
So who is an ideal candidate for liposuction and who is not?
So the number one thing to know about the technique of liposuction, assessing a patient for liposuction, is skin elasticity. So we have collagen and elastin fibers in our skin. That young skin, 20-year-old skin is very elastic. Literally, you could take fat, even if that person's a little heavy, you could take fat from there and it will probably retract, much like a balloon would do it. Think of a balloon full of air. You take out the air, the balloon just retracts. It's still nice and springy. And as we get older, or if you gain a lot of weight or pregnancy, and the skin is overstretched and damaged, now you've broken elastic fibers, the skin is not elastic anymore. You take out the air of that, and it's more like a plastic bag. It doesn't retract. The skin has nowhere to go. And that's where you get all the rippling and all the contour deformities.
One question, because I didn't address this before. Mari had said something about Morpheus and M-Sculpt. I was under the impression, and we talked about it, that Morpheus and M-Sculpt was basically for the face, but it's now being used.
So we have to talk about how different other types of fat, let's go back to that question, which is a great question, other types of fat reducing. So essentially you can kill fat cells several ways. One is just ripping them out. Another one is freezing them. That's called CoolSculpting. And then the other one that's been popular lately is radiofrequency. So radiofrequency, think of it like a microwave. It just heats up things and makes them hot and cells die. So the idea of radiofrequency is to go through the skin and melt the fat underneath. Again, all of these things are valid if you have the proper skin elasticity. You cannot take stretched out, damaged skin, remove the fat under it, and expect anything but to have wrinkled skin afterwards. And people are sold on this. They don't want to have surgery. When the skin is damaged, you cannot. Getting back to Morpheus on the face. So I do a lot of facelifts. And Morpheus is microneedling, which is now sticking little needles through the face and delivering the energy through the skin into the fat under the skin of the face. Now you're directly melting the fat that supports some of the most beautiful skin in our body is the skin of our face. It has great blood supply. So imagine sticking needles under the skin and burning. And that's what Morpheus 8 does. It melts the fat right under the face, right under the skin. And that fat is beautiful fat. It has an intimate relationship with the skin of your face. There's a little micro environment of hormones and growth factors and everything that's interacting there. Why would you burn that?
I
Well,
was saying,
I'm sorry.
you and I were both.
So I was just thinking what you said previously is that when you apply heat, that cell dies. So you start shrinking your face.
You can start. The other thing, a couple of months ago, the FDA, because there have been a lot of issues with the overuse or misuse of these devices, the FDA came up with a warning that you can have fat loss, scar tissue, nerve damage, contour deformities, and actually making the situation worse. So as a facelift surgeon, I would tell women when it's time to get a facelift, get the real thing, because all you're going to do is damage the tissue that should be in the right shape to have a facelift. The other thing about the Morpheus is it says it creates new collagen. It is absolutely true, but it's scar tissue. It's not new collagen like you had when you were a baby. It's collagen from a burn. Sure, but they spin it in such a nice way that it sounds, and it gives you all this new collagen information. Yeah, sure, you're burning your face. There's going to be new collagen, all right. So I'm not a big fan of it for the face. In the body, again, you're going to get maybe a 10% improvement. If you actually, in the right candidate, you do liposuction in an area, you're going to get an 80% improvement. So,
So,
education.
No, I am being educated.
for real. So it's not new collagen, it's scar tissue created by the burning.
It's not the same collagen, and it is scar tissue.
You are not a fan of all of these different procedures.
Especially I don't mind the regular micro needling because that's micro injuries. I like PRP. I like resurfacing, ablative lasers that resurface your skin. That's all sort of like taking layers off on the surface. But once you're getting under the skin and you're either damaging it, injecting, you can shift over a little to the biostimulators, like Sculptra. These things, again, they call them biostimulators. They all have these great names. Biostimulator. It's really an irritant that creates scar tissue. Now, in some cases, there can be an improvement because it was originally used for patients with HIV, with wasting, to improve their volume in their face.
Oh, interesting. I didn't know that.
But again, it needs to be used by an ethical professional in order to get great outcomes.
So realistically, how much fat can be removed in one session of liposuction?
So 5 liters is considered, especially as in an outpatient procedure, is considered the maximum we can take. And that's considered high volume liposuction. And when you take out fat, remember, we put fluid in before. So when you suck the fat out, some of that fluid comes out with it. So we're talking about really the fat floating on the liquid that we take out, the real fat. And so 5 liters, it's 11 pounds. And the state of Florida regulates that if you're performing another procedure, you shouldn't take out more than 1 liter of fat.
It's funny you should just mention that because I know stories. I've been in healthcare all my life, but I know stories of you being an ethical board certified plastic surgeon would do the right thing, but I knew people that ended up in ICU because they went to these facilities where they overextended procedures and then liposuction, and patients basically die.
So there's a lot to the medical tourism that happens here in Miami. It's happening all around the world. People now go to Turkey. People are going everywhere. It's called medical tourism, and it's a real thing. Now, like anywhere else, you're going to find good places or better places and not such ethical places. When you're trying to run something as a business, you have to understand that ethics and profit sometimes clash. And this is where if you find a price that's so good to be true, there's a reason. Somewhere that someone's cutting a corner. And you have to take that into consideration when you do your research. And how much do you value yourself, your life, your appearance? Because sometimes you don't die, but you end up what people call botched, which is mutilated.
Yes.
And
There's a lot of that.
And there are a lot of botched bodies here in Miami.
Yes, there are.
Everyone wears a faja and nobody sees it. But there are a lot of there's a lot of botch going on. The face is really special because you can't hide it. That's why none of these clinics really offer too much in the face department as far as facelifts.
It's a neck down.
Because you cannot hide it. Okay, you can have 50 pissed off patients running around town wearing their fajas and being okay. But if you screw up someone's face, it doesn't take very long for that to be.
Can't hide that, for sure.
No, the depression and the problems.
So they don't take, it takes a lot of training, a lot of dedication, a lot of the actual surgeon with the experience has to do it, which is something that also happens here in Miami with doctors from other countries doing the.
Oh, yes, that's true. They come and they set up.
So many other times at these clinics, the actual surgeon that you think is going to operate on you is not the one operating on you. It's usually an assistant. It could be a surgeon. It could be a good surgeon, but he's not a trained surgeon. He's not a licensed physician in the United States to be doing the procedure. and then they're trying to turn over because they run a volume place. So they have 40 people waiting in the waiting room. They have a bunch of operating for, and they have sometimes 3, 4 of these assistants working on a patient at the same time
Oh, God.
to turn over the room faster.
So is liposuction a weight loss procedure or more of a body contouring tool?
So I love that question because technically you do lose weight, okay? But so imagine we talked about 5 liters being 11 pounds. So if you did the right candidate, if you took away 5 liters and it was mostly in the central area, the problem you would have is the skin because you would reduce somebody by that much. But let's say an average person that you only take out a liter that has good skin elasticity, a little chubby, and has some fat on the abdomen, some fat on the waist. You'll take out maybe 2 liters, if that, maybe 1.5 liters. So now you're only looking at 4.5 pounds, right? And that can make a huge impact in the appearance of that person. Because to lose 4.5 pounds
It's a lot.
in this one little area, you normally have to lose 20 pounds in your whole body. So liposuction can be very effective in the right, because if you target the right areas, you're truly transforming that person in a weight loss perspective, the way they appear. But from an actual weight loss it's there, but it's not what's making the dramatic change.
Interesting. Now let's jump into liposuction and actually weight loss. For patients who lose significant amount of weight, when is liposuction enough versus when they do need skin removal?
So that's the judgment. That's where the ethics of the doctor comes in, and the training of the doctor. And again, profits and ethics. Somebody comes in and says, oh, I've had 3 kids, I have some skin laxity, I have some fat, and I have some muscle laxity, right? The doctor knows that's going on. But the devil sits on your shoulder. It says, she doesn't want, the patient tells you, I don't want surgery. I don't want big surgery. I just want a lipo. But you know a lipo is not going to work. So the temptation is to tell the patient, oh, you'll be fine with just lipo. In the patient's mind, she's like, heaven, I found a doctor that could do this for me. That's a recipe for disaster. That's someone just asking for trouble, the doctor saying, sure, I could do it, and the patient thinking that she's going to have a great result.
Wow.
And you'll end up with lumps, bumps, excess skin hanging. Because when skin needs to be removed, it needs to be removed. So we're back to the elasticity. How do you know? Well, judgment. You sit there. One of my favorites is to make patients sit at the edge of the chair and sit up straight and look down. And the roll that forms, then you have to assess that roll and say, hey, can we lipo that, and will it stay flat? Or is that roll being a little apron of skin folded over your waist?
Claro, because the liposuction doesn't actually
Address that.
address the sagging.
None of these, by the way, none of these treatments impact the actual skin very much. So when they're saying they're tightening skin, they're really burning what the skin sits on. The ablative lasers, they do burn the skin somewhat superficially on this top layer to take the top layer off. The radiofrequency, the deep radiofrequency, it's trying to get below the skin and kill the fat below, creating scar tissue below and hoping the skin above it will tighten. Now, there will be some tightening and you'll see it contract because you're technically burning what the skin is sitting on. And so there's another famous one, Renuvion, J-plasma. These are all, we've been using energy devices to assist in liposuction for years. So another one that was early on, because we did find that if you burn, create energy or energy heat trauma to the tissue, it will contract. The fat will contract, but it creates scar tissue. You have to be very careful. For many years, I've used Vaser. Vaser is ultrasound energy that converts to heat. So there used to be one that was called Smart Lipo. And that was Smart Lipo with a laser that would create the trauma. And now we have the Renuvion device called J-Plasma, which does exactly the same thing. The problem is Renuvion wants to sell it to anybody that's doing liposuction. And they think that this is the answer, that you can get away with not having a tummy tuck. And if you're not a tummy tuck surgeon and you just took a lipo course, you're going to treat everyone the way you were taught how to treat them. Oh yeah, I have this new device that's going to tighten your skin right up. You'll be great.
That's what they say. I hear that.
And yes, does it help tighten skin? Okay, so let's say you get 10% tightening, but you have 60, 70% damage. And sometimes the outcome is going to be whatever you had is going to look worse. Because now it's going to be, the skin doesn't have anywhere to go, so it ripples on itself. And this is when you see these people have all of these contour defects, we call them.
And at that point, it's surgery.
And then it's really hard to fix because now you have burns under your skin that don't stretch. So your skin is not normal anymore. That fat is now scarred. And it's really, really hard to stretch skin when there's scar tissue. So does it tighten skin? Yeah, it tightens skin because when I try to pull a botched job, it doesn't really move very much.
Yeah, actually, it looks awful.
So you just have to be careful who's doing it to you and why.
Yeah, some questions for. Oh, yes. Okay. So how do you determine, and I think you kind of addressed it, whether excess skin needs to be removed or if liposuction alone can create a good result?
This is where the 25 years of experience and judgment comes in. Lately, I've modified my tummy tuck procedures where in the past women would be on the edge where lipo by itself is not going to work. It's not quite doesn't have enough skin for a full tummy tuck. So in these cases, I do what's called a modified tummy tuck. The scar is a little smaller. It definitely removes less skin, but when you remove less skin, you have to deal with the belly button. And that's been traditionally, that gray area has always been tough because some women just have skin laxity or some skin laxity, not so much fat, and a lot of muscle laxity from, say, having a twin pregnancy. And so you can get in there, tighten the muscle, but then there's not enough skin to take out. And so it creates a problem. So a modified abdominoplasty, which essentially is allowing for the skin to come down, creating the new belly button, but it leaves a small vertical scar where the belly button hole was. If you think of it, when we leave the belly button, the first thing we do in the surgery is we leave the belly button where it is. We cut around it like a little tree. It's a little stalk, attach your muscles. That stays there the whole time. We lift the skin, we tighten the muscles, and then we pull the skin down. The belly button has to stay where it belongs. We're not doing Picasso's here. The belly button doesn't belong here, here, here. The belly button belongs in a very specific anatomical spot. People have tried cutting the stalk from underneath and pulling down, but then their belly button ends up in the wrong place.
Oh my God.
Let's just say,
I don't even want to think of it.
but think of it. It would be very obvious because humans, we see each other often. We kind of know where things should be. That's why Picasso's tend to look odd. So if the belly button's in the wrong place, you start going to, interesting. So the idea of the modified tummy tuck is to do the full procedure, tightening the muscle, et cetera, through a less invasive approach that leaves more skin, but it does leave a little vertical scar between the belly button.
Like a little C-section type of thing.
Or it's vertical. So the tummy tuck is standard but the little hole where the belly button used to live is closed in a linear fashion, vertical.
Interesting. That's funny.
So you're talking about the combination of the tummy tuck or body lift. What combination procedures are often done? And that's what you were talking
So
about.
since I do outpatient office-based procedures, I don't do more than 8 hours at one shot. It's not worth it. So being under anesthesia is really not such it's not as traumatic to be under anesthesia as people think. Being under anesthesia is your liver is metabolizing certain anesthetic agents, but you're really, now if you're in poor health, if they're doing too many procedures, lots of fluid shifts, you don't want to risk. This is an elective. So a lot of times in these massive weight loss cases, I'll stage certain parts of it. And my usual question is, what bothers you the most?
Oh.
That's where we start. And that often creates a beautiful journey of just transformation. And I've done many of those, and they're some of my most rewarding cases.
Yeah, I believe it. So in recovery, what is the recovery process like for liposuction?
So one of the things that, and I've heard, the traditional Klein formula was for the tumescent solution involved using lidocaine, which is local anesthetic. So it was a mixture of lidocaine, epinephrine to shrink the blood vessels. That's why you don't bleed so much. And normal saline, the stuff you get in your IV. So that's the solution that we put in. So there's 3 components. Again, not verified, but I've heard that these clinics, in order to save some money, they're not using the lidocaine. They just use the epinephrine and the saline. So they put them under dental anesthesia. They do their thing, and the patients wake up in tremendous pain. Because part of the Klein formula, when he first described it, was for local anesthesia in the office. And you inject some of this fluid, and you would just suck out the fat right there in the office in a small area. So the Klein formula was designed for local anesthesia, low volume liposuction. So when I perform liposuction, if you do it properly, when you wake up, you should have no pain. As the anesthetic wears off, you're going to start feeling like you went, it's an old saying, like if you feel rounds with Mike Tyson, you're going to feel, that's for the older crowd, MMA, 5 minutes in the cage. So something new, but you feel beat up. You feel like whatever areas have been beat up. The other thing that happens is you'll experience numbness for a while and swelling. And when you put in that cannula and you're going in literally thousands of times, some guys use power-assisted liposuction, right? Which is a air-driven device that oscillates. I'm still old school. I like to sculpt my patients by hand. I don't like.
Well, I've always said you're an artiste, so
I still think, and there are some guys that are really good at making ice sculptures with chainsaws. And I'm sure there's some guys that are extremely good with their power assisted, but I like to do my liposuction old school, shaping, sculpting, seeing what I do. Is when you have a little thing going like, like it's very easy to create, to make mistakes. And mistakes when you're doing liposuction are hard to correct. Once you get too close to the skin, that skin doesn't have the fat under it anymore, so you can get that depression. So if anyone's seen liposuction, it just looks really boring. It just looks like some guy going like,
it's not. I see that.
And each stroke matters. Each stroke technically matters. So if you're in the same spot and you're going like this, and somebody says, "Doctor, what do you want for lunch?" I'm like, ham and you're going to end up, by the time you're done with a sandwich, you have a defect. So even though it looks repetitive, there's definitely an art to it.
Well, isn't there a risk with that power assist, you perforating something you're not supposed to with the power?
You can perforate with power, without power. Perforation is just whether you're a good surgeon to know where you are. And if you were raised using power, listen, I'm sure people with power are amazing. I just never found it to be that much more effective of a device. And consider, when I compared my yield, the actual fat I harvest in the period of time, it didn't really. Um, but once you learn, it's like someone now in today's world, they use ultrasounds for everything. Like in the old days, we would do central lines just by knowing where the anatomy is, and we put. And now you ask an interventional person to put in a line, and they're like, "Give me ultrasound, and I need to see this and that," and so we've lost certain of the skill sets that we had. But if you're raised on it, then that's what it is. As long as you're going to a person that's a good sculptor, if they're using power, it doesn't really matter. As long as they know what they're doing.
So it is a little painful. And so how are the discomfort managed? How do you manage the
So normally standard 3 days of pain medication, always ambulating after surgery. You always want to prevent blood clots. And
Even oil liposuction,
yes,
you can have blood clots.
any procedure when the body's injured, regardless of how it's injured, you're gonna release stress hormones that are gonna make you clot because your body feels like and it said, I don't want to lose my stuff. So your body can increase its clotting ability. So if you're sitting around because you're in pain, you stay in bed, you keep taking pain medication, you sleep all day, you do it again, you sleep all day, you don't move, you do that for 3 days, you might get a blood clot in your leg.
Right.
And then you go get up and it goes to your lungs. And that's called a pulmonary embolism.
Oh, yeah.
So how do you keep that from happening? You educate the patient. You put compression stockings during the surgery, even though during lipo, technically you're being moved around a lot. You're not still, especially the way I do it. Some people put patients face down to do the back. I've always been on the side. I like the side better. And so in anesthesia, that position face down is called prone. Anesthesiologists hate it. Because if you're under general anesthesia and your face is here, then you have to worry about the eyes and the tube and this and it's a riskier position for anesthesia. They hate it. But it's a lot easier, especially if two guys are working on both sides of your body. My favorite way to do the waistline and the back area has always been with a patient on their side. And especially a woman, when she's on her side, that's when you can really appreciate the curves. When you're on your belly, you lay on your side, you can actually see the way the ribs come, the way the waist turns, and right into the hip and buttock area. And it's a great way to sculpt someone. And the anesthesia likes it better since they're not face down.
How long is the downtime?
You could be driving depending on how big the lipo is, but usually the first 3 days, I tell the people don't want to do much. That's when it's magic. After the first 3 days, the pain becomes more tolerable. I do like the lymphatic massage situation, but it has to be properly done. I cannot overemphasize. You can do lymphatic massage different ways. If you're going to be more aggressive, the technique is to not close the little liposuction holes and actually drain the fluid out of those holes. And that's where you see these really aggressive, and then it's pouring out.
Wow.
And that is a good technique in the sense that it is going to remove the fluid. I do. I'm not so aggressive. I like to create feminine forms. I don't like the caricature of the human body. I'm more classic in that department. I like beauty to be subtle, not overstated, not hypersexualized, which I think we're seeing a lot of this out there.
Yeah.
So I'm not as aggressive. So if you want that crazy, the Miami look, there are plenty of places to go to, but I create.
I think a lot of people are starting to move away from that Miami look.
Well, I think we've seen the peak of that, and then I think we're headed toward more subtle appearance, whether it's the body, the face, the lips. People are starting to realize that maybe, that doesn't look good.
Definitely.
So after the first 3 days that the pain starts to subside, when can somebody think about driving?
So as long as I tell people, as long as they're not on pain medication, probably after 3-4 days, some people, I wait about a week to give them Motrin, just for bruising and whatnot. But usually about 4 days, it's a pretty fast recovery. Because again, we're dealing between the skin and the muscle. We're not cutting muscle. We're not. So it's really a superficial. Now going back to activities, the issue is swelling because the tissue does have to stick back down. So the more you move, the more fluid you create in between there. And so even though they're doing your drain and all that, that little hole, and a lot of these techniques, and I've seen them, they go get their drainage and they have to pry open the skin hole again to get the fluid to come out because the skin wants to heal. Remember, liposuction, we make small holes in the skin, and then we get through that skin. The skin's very rough, I mean, very hard. It's like leather. It's hard to get through the skin. If you think about your skin, so think of like a chicken. Once you get through under the chicken skin, it's pretty easy to get around. But the skin is kind of the tough part. So the same way, that little hole in the skin likes to seal up pretty quickly. So unless you're prying it open and keeping it open, sometimes I use small drains for my lipos. The same drains I use for my facelifts, a very thin drain. And I rather get that fluid out than you can develop pockets of fluid called seromas.
Now, is it painful, the lymphatic massage after?
Now, if it is done that way, it is painful. If you're doing the rough way to actually push the fluid out. But there's such a thing as a lymphatic massage that's gentle to move the fluid away from the damaged tissue into the normal tissue. And that is the type of lymphatic massage that I offer at the practice. It's a very gentle massage, and it should literally feel like the slightest pressure. And how do you know that it's working? It's about 20 minutes in from this, like, what you thinking? My God, what am I paying for? You have to get up and go pee because your fluid has moved from your tissue into your bloodstream, and your kidneys are saying, get this out of here.
Right. Wow.
That's how you know.
Interesting. Yeah,
That-
that is very interesting.
Yeah.
So what are the risks and potential complications of liposuction?
So the answer to any surgery is bleeding and infection. Now, the risk of bleeding, if it's done properly, is minimal because we've changed the technique. We use epinephrine. So massive bleeding is not something that happens. Now, if you're, again, buyer beware. So a lot of these places that are very aggressive with the liposuction, sometimes are pushing the limits of the massive or the large volume liposuction that can be done. There are a lot of people that can lose a lot of blood during these procedures. And especially here in Miami, it's not uncommon for fire rescue to be taking some of these patients to the hospital to be treated for bleeding. And it's just, whether it's bleeding itself or they already started out with a low hemoglobin and then they're taking out too much and there are fluid shifts. And the key thing is judgment. The most important thing in surgery, it's not so much how good of a technician you are, is when to do something, when not to do something. So the other complications, and there are more side effects, the areas that get liposuction will become numb for a few months, probably 2 to 3 months. Because when you're going in with a cannula, you're beating up all those little nerves of the area. And it takes about 3 months for it to all grow back. So the lymphatics that grow with those nerves also take time to grow back. That's why people say your final result, it will be about 3 months. But I tell people your final result's about 3 months as long as you don't gain weight. Because one of the things I do is I weigh people preoperatively. And if I take out 3 pounds of fat, so now you're supposed to be 3 pounds after 6 weeks. Initially, you're going to be heavier because your body retains all this fluid.
Oh, this fluid.
So people weigh themselves. I'm like, I'm 10 pounds heavier than I was when I went into surgery. Yeah, your body's retaining a tremendous amount of fluid. So after about 6 weeks, you even out the excess fluids, and then you continue to shrink. So all things considered, you should eventually end up 3 pounds lighter Now, I've seen people come back in 2 months and they're 10 pounds heavier instead of 3 pounds lighter.
They were eating too much.
That means that they gained not 10 pounds, they've gained 13 pounds. Because remember, I took out 3. That's a big deal. So when people come back and they're heavier than they started, I'm like, we got a problem.
So diet is definitely important.
It's this great point, because if you keep your weight, you will keep your result.
Now I have an interesting question. Can lipo suction address cellulite?
Okay. One more thing on the risks and complications. Another thing that can happen when you're using the energy devices under the skin, whether it's phaser, plasma, there can be burns. And they've seen burns with Morpheus 8 on the face. This is one of the risks. So you remember, it's heat energy. The radio frequency creates heat. J-plasma is heat. Phaser is heat. It's how you use it. But one of the risks of using energy under the skin, liposuction, are burns. And I've seen, not mine, but I've seen horrible, horrible burnt areas of the skin from poorly performed liposuction.
One question before we get into the cellulite, because I know that the cellulite situation can be very prominent, but I just wanted to, safety during the procedure. What do you do?
So I use a board-certified anesthesiologist. You should go to a board-certified surgeon. I've worked with nurse anesthetists that are fantastic. So a great provider, all right? So that the facility is accredited, that is checked out, that the history of the facility. So make sure you do your homework. Are they certified by the state, by another credentialing body? Is the surgeon board certified? And what is the history of the facility? And I think looking at the track record, doing your homework is really important, because a lot of people get excited about doing something and they're thinking so much about what they want that they don't do their homework. And there's so many stories where people say, I wish I had done my homework. And then it's too late. So my advice would be, do your homework.
Thank you.
Quick question before we go into the cellulite. So it is safe to combine lipo with other procedures?
As long as you're not in the state of Florida, for safety, and I'm sure you can, judgment-wise, you could go one way or another depending on the health of the patient. But in Florida, we're limited to 1 liter of fat when we're combining it with another procedure.
That's the law.
That's the law. So tell me, can you treat cellulite and sagging skin with lipo?
Let's first understand.
Question.
Yes. So the first thing is understanding what cellulite is. Cellulite are little bands of connective tissue that hold your skin to the muscle layer. So these little tentacles of connective tissue that are technically holding your skin up. And you can actually see cellulite on babies. And it's completely normal. As we start to age, the skin starts to settle. And we start seeing these dimples that are the attachments of these connective tissues to other parts of your structure. So it's literally tethering points. So one of the treatments, I don't know to what degree, because ultimately it's a hard problem to fix. It's one of those things, like, it's really hard to fix sun damage, for instance. Like, once it's happened and people are more prone to cellulite, I would tell them, go in a pool, go into space, wherever gravity's not impacting you, because the treatments for cellulite are really few and far between. Lipo is not going to fix it. Lipo will just remove some of the fat. It might improve the appearance a little bit. Now, some larger pockets, like where you have big dimples, there's a little device, I believe it's called Avali or something, and it's a little needle that goes through and is a blade, and they actually cut the ligament. So you can maybe improve some of the puckering with that technique. I don't do it myself because I don't see it as a sustainable solution, because what are you doing? You're cutting how many ligaments are you going to cut? And then other ligaments are going to take over. So that one ligament happens to be the one carrying the tension. You cut that one, there's going to be one right by it. So the logic behind that one doesn't.
They don't call it the stubborn cellulite for nothing.
Now, in the same way, if you sometimes certain things can improve the appearance of cellulite. So sometimes if certain areas of fat grafting can be improved, increasing muscle size can improve it. So if you fill something, it can improve. But in general, it's just a normal, and a lot of people have it, and everybody hates it.
I've seen models.
Everyone has it. Everyone has it. And I just, it's one of those things that it's tough because, again, with social media today, you see these perfectly smooth bodies and that's what I want. I'm like, well, that person doesn't have that. So we're living in this world of fake selfie, a fake filter. And it's, the reality is that it's not real.
No. Yeah. And in a way it's sad.
Because we're all looking at each other through filters, and then we see each other in person, and you're like, and we lie to ourselves. There's a disconnect that there's. It's just maybe getting too philosophical, but
Isn't there a genetic disposition too for cellulite? Because I've met ladies that are 70 years old and they have very smooth skin. And
so a lot of it has to do with the body fat content, the thickness of the body fat. There's some girls that get it when they're teenagers.
Yeah.
And there are some that never get it. So usually is a genetic component, like you said.
well, thank you very much. Once again, this is very educational and
I have learned so
valuable
much.
information. So ladies, stay tuned for this hot topic coming up on YouTube and Mari Trilogy. Please don't forget to register for our Empower Her event on January 29th. I look forward to seeing you all there. Have a great day.
Thank you. I always learn so much with you.
Thank you, guys.
Thank you.
Thank you.